Hello, this is Dr. Kevin Connors again. In this video, we're going to talk about the kidney and bladder cancers. Kidney and bladder cancer are becoming more and more common. We see them in our office just much more than we did in years past. So it might be the exposure to pesticides and chemicals that we're kind of being inundated with. I don't know for sure, but we're seeing it more often in our office. Maybe it's just our office, but certainly we see it being more common. Whenever we're diagnosed with any type of cancer, it's definitely a scary thing, and we have a lot of questions. All the cancers, kidney and bladder, no different, are all separated into different divisions, different cell types. They react differently. The different cell types react differently to standards of care, like different chemotherapies. So depending on what type of cell it is that's part of what is going to be the diagnosis, and that is going to shape the recommended treatment. From a natural perspective, the diagnosis is a little bit less important because we're not treating the disease, we're treating the patient. We don't treat cancer, we treat the patients. So we're trying to build up your immune system. We're helping you detox. We're getting your body to be able to fight this disease. We're not fighting the disease. So as we get a cheek swab from our patients, we do a diagnostic test through that, and then we do a diagnostic test through a salivary sample looking at a person's genetics. That's where we're coming up with the decision-making process on our part. What are we going to do specifically for this person's cancer in the realm of their diet? We're looking for what is fueling the cancer, and we're going to take that away, not putting on some radical diet that it's impossible to stay on for any length of time. Then we're looking for cause. We're testing for that, cause or causes, working on detoxing that. If it's a pesticides or killing it, if it's a biotoxin, then we're looking at what specific nutraceutical, that is an herb or a supplement of some kind, not a drug, but a natural remedy that's going to be your best cancer balancer. So I'm sure if you've had cancer for any length of time and you've told the public, your friends, your family, you've got inundated with ideas from well-meaning people. Take this, my sister's brother's friend's uncle's cousin did it and it really worked when they did IV vitamin C or curcumin or Protocell or something. I understand that. It gets overwhelming. So our process is to help filter you through that. One of the big things that we hear in our office is people think that they can't do alternative care concurrently if they're choosing to do conventional care at the same time. And that's a really misunderstanding. So nothing that we're going to recommend is going to interfere with anything that you do from a conventional standpoint. We have a lot of our patients are doing conventional care as well. Some have exhausted it and they failed that. That's why they look to us. And I always think that's a little sad, because really you should look to natural things first. Whether you do choose to do standards of care as well, we should be changing our diet, changing our nutrition, changing the environment that got us to where we're at now, aka a diagnosis of cancer, in order to make your outcome better. Certainly adding alternative care to your current protocol is going to do nothing but improve your outcome. And that's really what our goal is. But like I said before, it gets confusing. So our purpose is to get very specific on what we're going to take away from a dietary perspective, what's fueling the cancer, what we're going to use from a specific nutraceuticals perspective to help your immune system be boosted to kill the cancer, what we're going to do with frequency medicine to help Rife technology improve your life, because that's what we really want. We want you to win. We want you to have more years to your life and a lot more life to your years. That quality of life factor is key. And no, regardless of whether you choose our care or not, please use our website and download our material. All my books are free. Goodness sakes, take advantage of it. Look at them. If you don't like everything, just take the good things that you like out of there and utilize it. We're trying to be a ministry as much as possible to our patients. So, and know that even if you don't choose care with us, you're in our system, we're going to be praying for you. And that's going to be your key component right there. Thank you so much.